So
Have a great meeting.
thanks, Lauren.
Thank you.
Thank you for joining this ACRL Access Services Interest Group 2019 Fall Virtual Forum. I'm Sue Garrison, Access Services Manager from Rice University, and I'm joined by my co-incoming convener, Constance Wade, Circulation and User Services Librarian from the University of Iowa. Connie will be monitoring chat throughout the session and will share your questions with the presenters during the final 10 to 15 minute Q&A section. Today's session focuses on dealing with mental health issues as frontline staff. Our presenters from Rice University are Agnes Ho, Director of Student Wellbeing, and Jerusha Kasch, Director of Institutional Crisis Management. Agnes is a licensed master level social worker with more than 15 years of experience working in public and nonprofit settings, providing counseling, outreach services, professional training, and supervised child abuse and domestic violence prevention programs to support family health and well-being. Jerusha has more than 12 years of experience working as an emergency manager. However, her experience in this area began many years ago as a young girl in a household that had a huge preparedness focus. Her family maintained a one-year food necessities storage process for 10 people. Once for Christmas, she and all her siblings were asked what item they wanted to contribute to the food storage for a year as their Christmas gift. And today we'll find out what item Jerusha chose. Without further ado, I'll turn the presentation to Agnes and Jerusha.
Thank you, Sue. Thank you so much, ACRL, to invite us to present in this session. And thank you so much for giving us an opportunity to talk about the mental health issues in our community. And again, this is Agnes Ho. I am the Director of the Student Wellbeing Office at Rice. And together with me today, we have...
I'm Jerusha Kasch, and for those of you who thought that I chose something healthy, you were dead wrong. I chose potato chips. And now you probably get a sense of who you're talking to now.
So Jerusha and I both are working here at Rice, and we both sit in a committee called Consultation Assessment Team, which we meet weekly to reveal some critical cases, which means like sometimes like student might present some concerning behavior. Sometimes it may be mental health related. Sometimes it might be more like behavioral focused. So we hope today we are going to share some of our experience and best practices so we can help you to gain some insight as a frontline staff in a library, what you could do to help the students or individuals that come to you and express their mental health concern. So a little agenda for today. So in the first half of the session, I will talk about what is mental health and how common of the mental health issue among college students. And we'll go into a little bit more detail to talk about what if there's some mental health concern, what are some of the early warning signs that you would know, and then what you can do, and in particular what you can say to the individual that you suspect there might be some mental health concern, or even sometimes maybe some suicidal thoughts. What can you do, and how can you get that individual to get some help? And then in the second half of the session, Jerusha will talk about some even more concerning behavior when those mental health issues become like a safety concern, or those behavior become threatening. How could you know? How could you recognize those threatening or concerning behaviors? And Jerusha will also talk about different types of threat assessment and what typical like threat assessment we will use in a university setting. And at the end, we'll also talk about how to recognize those concerning behavior and also what you can do about it. And of course, in the last 15 minutes, we will leave for you guys to ask any questions. And I know throughout the presentation, there's also a chat box that you can ask questions from there. All right, So again, this is who we are, and we put our email addresses on the slide. So feel free to give us, send us an email, contact us if you have any questions after the session. So before we get into the question of what we can do to address mental health issue, it is very important for us to understand the issues and how they affect us. Right now, I would like to take a couple seconds and invite you all just to think about what does mental health mean to you. So right now, you maybe think about some of the experiences in your life or your work or your family, because some of these experiences might have informed on what you believe about mental health. And if we look at our society, the social norms, and very often mental health, it's very difficult to talk about. Of course, we might feel happy, right? That could be part of our mental health. But when we talk about mental health, people tend to think about the negative side of it, because the fact that there's still a lot of stigma around mental health issue. So this is the way that we typically explain to our students why this is so difficult to talk about mental health issues. So if you look at this graph, when we talk about mental health issue, it's a wide spectrum. It could be a wide range of different presenting mental health behavior that you could see. Obviously, from the very left, you could see some presenting behavior. Could be maybe more behavioral, right? Like people might telling you, I couldn't sleep, or I might sleep too much. Maybe they come to you in tears, or they've been like, very emotional. There might be some anger involved, or maybe like very distressed by shutting down everything, even the emotions, or sometimes people might rely on some other coping mechanism. Could be using substances, could be like having some self-harm, or even like suicidal behavior. So there's a wide range of different like mental health presenting issues that we might see. But if we look at that, of course, right, it's sometimes scary, even for people who struggle with mental health issue. They have a hard time to talk about it, because when we talk about it, people might react. People might not know what to do. People might be like really think like they're crazy, or they are not being able to function. And that's why it makes it even harder for people to talk about mental health. And then on the other side, for people who concern about individual who might struggle with mental health, they don't know how to approach that. They might see all these presenting issues, they might see all these presenting mental health concern, but it's just hard to like be straightforward and ask about those questions. So hopefully today we can give you some more idea on like how to really break the ice, right? How to really connect with that individual and let them know it's okay to talk about that. So we really love this iceberg theory, because when we look at these presenting issues, we also wanted to dive in and dig into it and try to know what exactly happened underneath all these like presenting issue. So a lot of time what we know is all these issues, there's like a lot of emotionals underneath of these problems. Maybe like the student might be worried about they don't fit in. They might be homesick. They feel very lonely. They might be disappointed about their academic work or their grades. Sometimes they might be different things. Maybe their values and beliefs might get challenged. Maybe they have a recent breakup, or they might lost someone that they loved. They might going through like a grieving process. They might be, adjusting, right, like a new environment. Or it might also be an existing or underlying physical health or mental health concerns. Sometimes you may be able to figure out and cope with it on their own, but most of the time, what we know is people might want to have someone to listen to them and support them through all these emotions and issues. So by just like looking at the definition, we know we all have mental health. Mental health refers to our emotional and psychological state, our social well-being, and also how we feel about ourselves and interact with others. So it's a good thing, right? We might feel fine sometimes even when we struggle, but if we are able to reach out and handle our life challenges and stresses and have a meaningful relationship and make sound decisions, that might be fine. But sometimes when mental health becomes a problem, which means even when we struggle, we have a hard time to balancing, or even maybe we're talking about functioning level, then it becomes a concern. And sometimes it could also be what we call like a mental health conditions, maybe like a diagnosis that we might have. And what we really look into is like 3 different areas. We usually look at our cognitive thoughts, how we think, our mood, how we feel, and also our behavior, how we act. And all these areas need to be like strongly connected. If one of these areas not function well or we don't feel well, then that becomes like a concern. And very often that's how we look into like the mental health issue. And we'll talk a little bit more about that, all those signs in all those 3 areas. But all we know is like mental health, even we have a mental health conditions, it's okay to talk about it. If we look at like some of the statistics, in particular in a college and a university setting, so I pull up some data from the National College Health Assessment done by the American College Health Association. So they've done a survey in a lot of different universities every semester. So this is the most latest survey that they did in spring semester 2019, which is this year. As you could see, anxiety and depression, it's very common among college students. And then other than that, there's also like a couple other different mental health conditions, like panic attacks, ADHD, insomnia, and also there's like, other diagnoses students might have. And what we know is anxiety and depression are very common mental health conditions. And of course, there are some students might even diagnose with both anxiety and depression. And what we find is like students, when they said, yeah, I have depression or I have anxiety, seems like, in a college setting, they're more open to talk about that. But, if there's any other different diagnosis, they might be a little bit like resistant to talk about that. So most of the time, we know there's also like stigma around. So in our campus, we rely on a lot of like different educational programming and also student groups to talk about it. Yes, it's very common. That's why it's okay to like speak up and ask for help. So when we talk about like some warning signs, we also wanted to talk about, these like 3 different areas. Like what I said in the beginning, like we want to look at the connections, how we think, our emotions, and also behaviors. Because what we know is we cannot change behavior, thinking, and our feelings unless we address all these 3 areas. Which means what we think, how we feel, and also how we behave are strongly connected. Because all we know is we are emotional beings. We cannot separate our thoughts and our actions from how we feel. So that's why when we look at all these like early warning signs, we typically also want to look at these 3 areas. For example, when someone like, think about that they don't fit in, or they feel like everyone is better than they do, they feel happier than they do, or like, they don't think they're worth it, that could become a concern. The emotions, right? They feel very much like, like not happy, or they feel very much intense sadness. Maybe they like these extreme feelings. They worry a lot. They fear a lot of different things that might be happen. They tend to think about like the worst case scenarios all the time, and that makes them feel very anxious. And of course, we also look at the mood swings, like very severe mood swings. All of a sudden, they might feel really like upset about something. There might be a reason, or there might not be a reason. And then also, we look at the behaviors. We typically look at the functioning level first. For example, like how they are eating, how they are sleeping, whether or not they eat too much or not eating at all, or sleep a lot or not sleeping at all. In a university setting, right, we often check in with their social support, right, whether or not they are able to maintain their friendship with their friends, how they interact with their group mates in their classes, how about professor, how about, the family members. So those also like important to look at. And of course, we also think about if they have any other coping mechanism, like let's say, any substances involved, or any other different things that they cope with the situation. So these are the three typical areas that we will look into when we talk about warning signs. And of course, sometimes students might have some more safety concern. Then we will also look into these three areas. But what we are looking into is the drastic change in these three areas. For example, their cognitive thoughts. Have they been thinking about, feeling of being a burden, and, they have no reason to leave, or feeling very hopeless for, a period of time? And the emotions. And again, they might feel like this hopelessness for a while, and they haven't been able to figure it out or been able to address that. Sometimes it's interesting too. Maybe this student might be feeling very dark, very depressed for the whole time, but all of a sudden they've been telling people that they are fine or they feel happy. Yeah, that actually is a concern. Not necessarily that they feel better, but maybe they might feel like, okay, why I care anymore? I don't care about that. Maybe they are thinking about ending their life too. And of course, we look at the behavior, right? Any drastic change of behaviors that we might concern about. Maybe they have been talking about hurting themselves. They might be looking for ways to kill themselves, looking for internet, or maybe they have been giving their possessions to people. Sometimes they may be very open to talk about it as well. May not be verbal, maybe through social media, right? Thinking about the generation these days, students might be very open on the social media to talk about that. So those are the areas that we really want to look into. And of course, just because we see one of these warning signs doesn't mean that a person is suicidal or have a mental health condition. What we know is it is important for everyone to be able to recognize all these warning signs, because we never know who you are going to interact with, especially for most of you working in the front line, everyone can come into the library and talk to you about that. And we really want to emphasize when we recognize these signs, it is okay to let that individual know that I'm concerned about you, because it seems like you've been feeling like this for a while. So hopefully these warning signs would be a really good way to get started for you to know, okay, whether or not I need to intervene and talk about that. But very often we know, even though our guts might tell us, hey, I don't feel well about this individual, I might have all these signs that I worry about this individuals, but why this is so still, it's very difficult for us to talk about that. because of our society, we still have a lot of misconceptions and a lot of myths around mental health issues. For example, right, a lot of us might think about there's nothing we can do, for a person with a mental health problem. But we know this is a myth because anyone can make a difference, can make a big difference. And if we look at the research, only 44% of adults with diagnosable mental health problems receive needed treatment, which means a lot of time people might not even start a treatment, but then they have all these signs and they might be, have all these like mental health concerns, but they never really like talk about that, or they might not know what kind of treatment or what kind of help might be available. So which means this is very important for us to say something like this. We can say, I have been feeling very concerned about you lately. This is the signs that I've seen or I've heard. How can I best support you? By saying this, basically we give permission for that individual. It's okay to talk about it. It's okay to get some help about that. It's okay, to find some support, for you. Another myth that we heard very often is people might say you can snap out of it if you try hard enough, right? Or if you try something, if you work harder, if you, maybe like, stay in the library longer, to study, right? You might be able to, pass the class. But again, this is a myth because what we know is mental health problems have nothing to do with being lazy or weak. And many people actually need help to get better. And again, what we know is many factors contribute to mental health problems. That could include biological factors, that could be the genes, that could be like some physical illness, maybe injury, maybe our brain chemistry. And that also could be because like some of our life experience, right? That could be some type of trauma, maybe like involved in a relationship violence issue, or maybe like a domestic violence issue, maybe a history of abuse. And also that could be because some of them like might have like family history of mental health problems. And again, all we know is people with mental health problems, they can get better and recover. Some of them, if they get treatment, both what we know is like therapy and also medication management, many of them can recover completely. So having this concept in our mind that can help us, of course, we can say something, right? Like, again, right, to open up the conversation, we can tell that individual that I've noticed something different in you and wonder how you're doing. Let's talk more about that. So hopefully, right, they can start to talk about all the underneath concern, like the iceberg that we talked about. Maybe there's some underlying issue going on that caused them to feel in a certain way. Another myth a lot of time we heard is many people think mental health and violence go hand in hand. People with mental health issues, they must be violent or crazy. And again, this is a myth because what we know is many people, most people with mental health problem or mental health illness are not violent. And only 3% to 5% of violent acts can be attributed to individuals living with a serious mental illness. In fact, people with severe mental health illness are over 10 times more likely to be the victims of violent crime than the general population. So if you think about it, maybe you probably know someone with a mental health problem, and you don't even realize it because many people with mental health issues, they're highly functioning individuals and they're highly active and productive members in our community. So, which means we need to approach people very differently. We need to have this like non-judgmental and open mind to talk about that by saying something like, I may not be able to understand exactly how you feel, but I care about you and I want to help. sometimes we might not even know what to say. We might not know what to do. And we can be transparent. We can say, wow, thank you for telling me about that. I don't even know what to say, but it seems like that's very difficult, and I'm here, and I'm available to talk to you more, or I'm happy to find out more resources to support you. Let's talk about it. And again, giving that permission to the individual to talk about that make a whole lot different. And then another myth, in particular, when we try to talk to individuals who might have a suicidal ideation or suicidal thought, it's really difficult to open up the conversation, because we might think talking about suicide might give that person an idea. If we talk about that, then they might even think about it and then do it, right? And again, this is the myth, because the fact that we don't give a suicidal person an idea by talking about suicide. Actually, the opposite is true. Bringing up the subject of suicide and discussing it openly is one of the most helpful things we actually can do. So if you feel comfortable, you can even say something like this: have you been very unhappy lately that you've been thinking about ending your life or kill yourself? And I'm worried about you. Let's see what we can do to support you. And then the last one, we might think people who commit suicide are people who were unwilling to seek help. In fact, most people who are thinking about suicide, they do not seek professional help. And what we know is that they do often communicate about their distress, what's bothering them, to people around them. It could be their friends, a family, classmate, someone that they know, or even someone that they don't know. Oftentimes, we know most severely depressed person has mixed feelings about death. They might not necessarily want to die, but what we know is most suicidal people, they actually don't want to die. They want the pain to stop. They just want to end the pain. So that's why it's important for us to let them know there's hope. And there's solutions. There's way to help you. There's ways to, give you some more help. And we can, help them, even though we might not know exactly what are the resources available. Maybe we can say something like, have you thought about getting help? Maybe let's research some of the resources available on campus, or maybe in a community to get you some help. So again, right, giving that hope, it's very important to that individual. So on our campus, we often tell our students how they can best support their peers or anyone that they're concerned about by reaching out to them. Again, right, don't be afraid to talk about it by opening up the conversation. Be straightforward to tell them about your concern. That could be the feelings that you heard, that could be the behavior that you observe. You can reflect the things that I told you by saying something like what I hear, or what I've learned, or I'm concerned you because I haven't seen you for a while, or what I hear is you're feeling very frustrated, you're feeling very desperate. And again, very often we might be so tempted to get into fixing the problem or offer solutions in the very beginning. But oftentimes individuals might just want us to listen, might want us to be emotionally available or physically emotionally available and listen. That's what we can start. That's what we can do. And of course, the last thing that we need to do is making sure you are not alone, even though you're very caring, you have a good faith. And sometimes the issue may be way too big, way too much for you as well. You might feel overwhelming, and making sure that you are not the only one to help that individual, making sure to refer the student to other resources, and even professional help, because A lot of time, there's, especially in a university setting, there's already a lot of support system and resources in place to help students. Referring students to the proper resources doesn't mean like they will get into trouble, but in fact, getting them to get help, it will just like get them more hope and more solutions in place. So that's the reason why refer and consult often and early, it's very important. And again, your willingness to listen and to help can actually rekindle the hope and make all the difference. But sometimes if you feel like you cannot ask the question, or if you feel like you're not the right person to talk to the individual, or even like refer the individual to other resources, making sure you find someone else in your office can do that. Or maybe if you're working in a university setting, you can call the counseling center number and consult with them, and that would be also a really good way to go. So at Rice University, we do have a guide, more like a support guide for students and also faculty and staff, to help them to think about at what point do they need to intervene, or what they can do to help students, and what kind of resources available. And very often we encourage students, faculty, and staff to think about this question. If you know someone seems like they are in need of support, what can you do, right? How could you respond? Who you can talk about? And ask yourself too, do you think the student need immediate medical or psychiatric attention? And or do you feel threatened or believe that anyone may be in danger? So this is a very important question, because if you look at the guide, kind of like a roadmap to guide us to think a little bit more about that. If the answer is yes, and in particular, if this is an emergency situation, we hope you don't need to intervene, because there is professional help, including emergency professional help. The university police would need to be informed. Or let's say, if the situation is like way out of control, there's already very concerning behavior, even safety concern. We hope you might have some kind of panic button in your office, or maybe you can even call your police on your campus to intervene. And also there are some other resources available. For example, a lot of universities do have counseling center in place, and a lot of time they're the phone number is 24/7 available, so you can consult with the counseling center if it is not urgent, but you feel like it's life-threatening and you don't know what to do. For example, if an individual tells you they are having these all these suicidal thoughts, they might or might not have a plan in place. So it will be a good idea for you to tell the student, maybe it's good to talk to a counselor. And you can even call the counseling center and hand the phone over to the student and let them to assess the situation. The other great resources that Jerusha will talk a little bit more about is a lot of university settings, they do have crisis management team or risk management team in place. So they will be also another good resource to consult with. And Jerusha will talk a little bit more about what type of threat assessment that the team would do, and also be able to help with those situations. But very often what we know is sometimes students might be struggling with their mental health, but may not necessarily have a safety concern, or may not have the threatening behavior presented. Then it's a good way to refer students to a lot of different supportive services. So in this guide, we do have our resources in Rice University. What we encourage you to do is maybe you can look at the resources in your university. Maybe maybe you can find similar offices and resources in place. For example, again, right, the counseling center and also the well-being office at Rice is more like likely like a case management services, which a lot of university nowadays, they do have it. Some of them may be housed in the dean's office, some of it may be housed in the housing and dining area or residential area. Typically, the case manager will be able to help the individual to connect the dots and also navigate the resources on campus. And of course, if it is a physical health issue, don't forget there is like health services in place. For us, Rice is a residential college, which means we do have a lot of like great faculty and staff living on campus. They can help. For a lot of campuses, maybe like get in touch with their residential staff. They might also need to be involved because they are the ears and eyes for students who live on campus. If it is a judicial, like a behavioral concern, maybe like judicial programs could be helpful as well. And don't forget, like a lot of like students who have a mental health conditions, they might be eligible to also register with the disability support services. Maybe they get, you know, some housing accommodation or academic accommodations. And very often when students hear about that, they, again, right, they learn that, oh, wow, there's a lot of resources and solutions that I can do, again, right, giving hope, giving solutions, that would be very helpful. And of course, sometimes like we also like work with graduate students population as well. And the issue with graduate students could be very different than the undergrad. So don't forget to reach out to the graduate students. And also there is like the dean's office for the graduate students would be also a great support for them. So again, we encourage you to find out all these resources on your campus. And don't forget about the resources in your community, especially those emergency contacts. We encourage you to look at what are some of the, local police department, local numbers. Maybe in the police department, they do have a mental health unit, or there might be like some crisis intervention team in the community, and typically they're also available 24/7. If your university have connected with like hospital around the area, that will be great to connect with them, because sometimes students might need further evaluation. They might need further mental health assessment, and that could be done in a hospital setting. And there might be some mobile crisis outreach team in the community. And last but not least, it's always good to mention there's a suicide hotline that students can call, again, 24/7. And also, we would like to bring up like sometimes we also need to check in with the law. What's the law in your state, inform us what to do, in particular in the Title IX area. So for some of you might not know about Title IX, Title IX is actually like a federal law. The full name of Title IX is Title IX of the Education Amendments Act of 1972, which is a federal law that protect students, basically, and also have university or any higher institutional, just to make sure we provide support and resources for students who experience any types of interpersonal violence relationship, making sure they are informed about all the resources and reporting options available. So here in Texas, we do have a Texas legislature, a Senate Bill 212 just passed in the past session, which requires all employees of a university in Texas to report a Title IX, to report any interpersonal violence issue that we know to a Title IX coordinator. So this is something really new that, you know, this past session, which means any faculty and staff other than staff in the counseling center and the health services, because they consider them as a confidential employee. But other than that, everyone who work in a university, we do need to make a report to the Title IX coordinator and to contact, you know, the office, the Title IX office. So this is just one example that we encourage staff and faculty to do on our campus. So again, we do encourage you to check in with the law in your state and also in your university, and making sure if students approach you and talk about their interpersonal violence issue, making sure you know what are the resources and support available for them.
Okay, so this is Jerusha, and I'm just going to take you just for a few brief minutes on that idea of recognizing this behavior. And sometimes this is really tough. Usually when we're talking about the normal or typical behavior, we're just talking about, one second. When we're talking about normal or typical behavior, sorry about that, we are talking about things that, you know, we may observe or may not observe. It's everyday things that are happening. And then if you're talking about abnormal behavior, it's pretty clear when we're dealing with that. We know when we see abnormal behavior, it's, you know, everybody's looking around at each other to see if you saw that too. It's something that, you know, it's clear that it's something is outside of your norm. It's that middle thing that is, you know, should I report this or should I not report that? So the normal behavior, we're clearly not going to report. The abnormal behavior, we clearly are going to report. But that middle section is really that questionable or concerning behavior. I put this slide up here with the bird because the bird is trying to make a decision. Should I bite that nice little cool bug right there, or should I not? And that cool little bug right there is a scorpion. So it's that should I report or should I not report? I'm seeing, as a librarian, I'm seeing these things that bother me a little bit, but they're not criminal. They're not super scary. They're just odd. And it's not odd enough for me to be concerned. And it's really hard for us to identify exactly what that is, because as librarians, I'm sure you would agree with me that you are dealing with the entire bell curve of the population that comes through your door. You are seeing a lot of things that are odd. And how do you address that, and what do you do? So I think it's that middle section that is really that most difficult on figuring out what are we supposed to do. So as we move on, and the reason why I'm focusing on reporting right now is that really that is, besides calling the police in that really scary moment or just everything being normal, it's really that middle difficult section that you're going to be running across, and helping you as librarians, frontline individuals, understand how you're going to integrate what you're seeing that may be questionable, how to deal with that in a way to advocate for the student and keep yourself safe. Both are equally important. So I thought we could just take a moment by thinking, what are you going to report? You're reporting observed behavior. And I take your mind to the bottom bullet point right there in that section. Realize that requires you to actually observe things. Sometimes we get into, there are times when I have a long commute in the morning. I live outside of the Houston area, and sometimes I arrive at campus wondering how I have driven that far because my mind was somewhere else. So I think it's really key and important for us to realize we have to be observant. We have to be vigilant. We want to know, you should report things that are a danger. You should report things that may be odd. They may not be criminal or disturbing, but they're odd, and they're odd for a reason. I always articulate this. If you're looking around going, did somebody else see that? It may be something you want to start talking about or engage in a conversation about, or just seek some more information on. If it's repetitive, odd, or concerning behavior, it may be nothing, but it may be something. I will tell you, once in my own life, as an emergency manager, I used to commute into downtown Portland, Oregon. And I rode a train to do that. And as I was riding a train, I noticed someone dressed in ethnic clothing walked up and videotaped a bridge from multiple locations. So everybody on the train, this was right after 9/11, and everybody on the train was really a little weirded out by that person taking many camera shots and videoing of a bridge or an infrastructure or system. You know what? I reported that. No one was doing anything wrong. It's not against the law to take pictures, but it was concerning enough to me that I wanted somebody else to know. And that's what we're going to talk about on the bottom of the screen just for a second, and to make sure that it doesn't mean it's a criminal activity. It doesn't take criminal activity for you to share concerning behavior, because our goal is to mitigate threatening or disturbing behavior by assessing and getting help. So who are you reporting to? It can be all sorts of people: campus police, your supervisor, coworkers, campus threat assessment teams like Agnes was talking about. We have a campus threat assessment team. Ours is called the CAT team. Yours might be called something else. But if you haven't met with them or identified who they are or how to contact them, that should be your homework for today. Or you could call your crisis or emergency manager and reach out and find a channel that's best for you and your staff. And when do you report? This seems obvious, but at the time you see it or any time thereafter. It's never too late to communicate something that seems to be odd or bothering you. It may be nothing, but it may be something. And if it's nothing, we'll do nothing with it. If it's something, we will take some action, and hopefully it's positive to keep everyone around us safe and to advocate for the students' ability to be successful, because that's why we're all in this business, is to help our students be successful. And then how do you report? For me, it's the rule of two. It's if you're telling someone something that's odd, follow that up with an email to the person, to your supervisor. That's why I call it the rule of twos. Articulate what you're seeing, but also follow it up in writing. It's easy to forget when you tell someone something, but popping it in a document that's searchable later is always very helpful. And you can also use an anonymous reporting tool. So, so that you understand that if your campus has a threat assessment team, here's some of the people that might be included in that team. You might have campus police, campus emergency management, behavioral health and counseling, Title IX, student services, academic affairs, attorneys, and other teams as appointed. If you don't have one of those teams on your campus, you should maybe engage in some questioning. How come we don't have this? How do we facilitate these behaviors to make sure they're not threats and make sure that the students are getting the help they need when we identify them? So that's also some homework for you. So maybe you can get something started on your campus. There's a lot of resources out there right now about that. Okay. And then lastly, as we move forward, I just wanted to give you some examples of some threat assessment tools that are out there. We won't go very deep into this. There's a link at the bottom of this slide. There are a lot of threat assessment tools out there. Some are better than others for college, or some are better for others in clinical settings. Some are designated just for workplace, but there are many threat assessment tools. And as you go on, you can see that on some of the tools, I just highlighted the NBITA tool here. It's one of my favorites. It kind of outlines threats as if, and this is just a portion of the NBITA tool I want you to draw your attention to, but it says, well, here's what we think is mildly threatening behavior, and here's what moderate is, and elevated, and severe, and extreme. You can Google all of these. They're at your fingertips. You're librarians. You could find them probably way faster than I can. but just know that there has been a fair amount of effort to try to classify these behaviors so that we can assess and move forward in a way that's helpful. So one of the outcomes that we really want is if you're a librarian and someone comes in and says something and it was a veiled threat and it really bothered you to the point where you can't forget about it, that you know where to go to report that, and that I wanted you to know how we handle that, what happens after you report that. So if you report the behavior, it takes literally a village to be able to understand, to get a well-rounded view. So your campus assessment team may get this information from your wellness or for whoever you report to, and they're going to look at how the entire world of that student is operating. How can we get them care and help and feeding and mental health access? How do we make sure that whatever they're going through doesn't seem as bad as it is, and they get the access to the care that they need? So that's what this team is about. Remember, the teams on your campus cannot act on what they don't know. So articulating what you're seeing, the issues that you're having is key, so that we can be clear about how we can best solve the problem. And a coordinated discussion, which I think is really important, of all of the departments on campus who are there to help our students be successful. That's how we mitigate the efforts and inform critical points of situational awareness during times of crisis response. It's by having all the people that are necessary at the table to be able to make that happen. Okay, I'm going to turn it back over to Agnes really briefly. We're going to finish up here, and she's going to talk to you about what we mean by culture of care.
Thank you, Jerusha. And again, right here at Rice, we do have the culture of care for the last 10 years, and that really helps to break the stigma for the students to take the courage and also speak up and ask for help. And I know, like, sometimes as a librarian, like, it's difficult too, because you don't know the student, or sometimes it could be a commuter, right? Like, you don't even know if they're a student or not. So if you don't know the person, sometimes it's hard to engage or even connect with that individual. So today we hope that, giving you some idea, if you have some concern, whether or not you know that individual or not, there's also like some way that you can approach. Let's say if you feel comfortable to talk to that individual, it's okay to be straightforward, just to talk about the concern that you have, the things that you hear, and ultimately let the individual know there's something or there's some resources be able to help you and offer you hope. And by doing that, it already means a lot, and that you are already a very caring person, even though ultimately you might not be the one to really help to fix the problem. And it's okay, and we don't recommend you to take the full responsibility to help someone to solve the problem. Today, this is just a snapshot about the mental health, kind of like a mental health 101, and how to address mental health issues, and also some concerning behavior issue on campus. But if you want to learn more about mental health and mental health conditions, there's a lot of programming on campus in different universities. These are the two very common and very well-known programs across the board. A lot of universities do have that, like Mental Health First Aid, and also QPR, which is Question, Persuade, and Refer, like a suicide prevention program. So it will be great if you can go and check that out. And here's some references that we use for this presentation, and feel free to look into that for more information, or send us an email. Let us know if you have any questions.
Agnes,
okay, thanks for your time.
Yep, thank you so much for your talents and treasures that you shared with the library community today. Thank you so much for your references. Librarians always love references. And thank you all the participants for attending today's session. We're including a survey to today's presentation in your chat window. So all you need to do is just click the link and answer this very brief survey to help direct the conversation for our spring forums. We will have a second part to the fall virtual forum in December, so please check your email for an upcoming announcement. And for those of you renewing your ALA memberships, we encourage you to select Access Services Interest Group as a community member. So when the interest group applies to renew its status with ACRL, ACRL considers the number of members in the interest group when making its decision to continue that group. And so that's very important for us. Thank you again, Jerusha and Agnes, for your hour. We appreciate it. It's been a very helpful and pertinent topic for us to discuss today.
All right, everyone, this is Lauren from ACRL. I'm going to stop the recording now.